So 3 days ago, I posted a video on lithium, right? So today we're gonna do practice question and answer around 12 to 13. And I hope you have watched that video and you will be able to get all of your answer correctly when we practice today. So if you have not watched that video, please make sure you watch it to understand the content. Because once you understand the content, it's gonna be super easy for you to crack all of your answer. So that's what we're gonna do. We're gonna do practice question and answer because I did not able to do practice question and answer on the last video because the video was already 9 or 10 minutes long. But in this video, we're gonna do practice question and answer. So are you ready? So try to pause the video and try to solve yourself to see if you're able to get the correct answer. Because when you're studying for your Nclex exam, you must know your content. Once you know your content, you will be able to get your answer correctly. So let's begin. First question, which symptom should the nurse report immediately in a client taking lithium? So which symptom you going to report immediately? Mild thirst, fine hand tremor, diarrhea, increased urination. So as I mentioned, three things are important: lithium, sodium, and water. They are three friends. If if sodium and water level dropped from the body, the lithium is gonna be very angry and gonna create the lithium toxicity. So how we gonna get the right answer in this one? So which symptom should the nurse report immediately in a client taking lithium? So let's say early symptoms are GI symptom, right? Which I mentioned: nausea, vomiting, diarrhea. So if you noted patient has diarrhea and vomiting, that's when it's early symptoms of lithium toxicity. So that would be your immediate right answer. Because if the patient is having too much diarrhea and too much vomiting, that means the patient is losing a lot of water from the body. So when the water level drop, as I mentioned, the toxic level will be up. Final answer C. Next question, lithium toxicity is most associated with which electrolyte imbalance? So as I mentioned, lithium, sodium and water, three friends. So if the sodium level drop, what we gonna call? We're gonna call hyponatremia. So answer B is your final answer. If sodium level drop, toxic level go up. So hyponatremia. Answer B. Okay, question number 3. A client on lithium present with tremors, confusion, and vomiting. What should the nurse do? So, what should the nurse do? Continue with medication, check lithium, give antiemetic, or encourage fluid intake? So, the best answer is there is no option to hold the medication, right? So, next answer, the best answer is check lithium level. That would be your final answer. Next question, a client with taking lithium carbonate for bipolar disorder reports nausea, hand tremor, and diarrhea, right? The nurse note that the client recently started taking ibuprofen for back pain. Which action is the best priority? So as I mentioned, you have to avoid NSAIDs with the lithium. So what is the best option here? So hold the lithium and notify the doctor is your best option. You have to tell the patient, you have to tell the doctor that patient is taking also NSAIDs. Next question. A nurse is caring for a client taking lithium for bipolar disorder, right? Which finding should the nurse report to the provider immediately? So mild hand tremors, they are normal. You just have to monitor. Increased thirst, nothing. Nausea and vomiting. Nausea and vomiting, you must report to the doctor so they can adjust the medication. So final answer is answer C. As nausea and vomiting, patient will lose a lot of water. And when patient lose a lot of water, toxic level go up. A patient with bipolar disorder is prescribed lithium carbonate. What is the therapeutic serum level for lithium? So as I mentioned, you have to remember table of 6, right? So what's the good answer here? 6 times 1 equal to 6, 6 times 2 equal to 12. So answer C, 0.6 to 1.2, final answer. A client taking lithium says, I have been having diarrhea and my hands shake badly. The lithium level is 1.9. What is the priority? So the lithium level should be only 0.6 to 1.2, but 1.9 is already toxicity. So what we're gonna do? We're gonna hold the dose, hold the lithium, and notify the prescriber. A nurse is teaching a client newly prescribed lithium for bipolar disorder. Which instruction is most important to include? So you have to tell the patient to, what you have to tell the patient? You have to tell the patient to maintain consistent salt and water intake, because salt, water and lithium should be together all the time. So always maintain consistent salt diet and water intake, at least 1 to 2 liter in a day. Next question, a patient on lithium therapy present with severe diarrhea, right? Tremor and confusion. What is the nurse priority? Hold the next dose of lithium and notify the doctor. That's a priority. Which of the following medications should be avoided in a patient taking lithium? Which medication should be avoided with lithium? NSAIDs. So what are the NSAIDs? And you have to avoid diuretic with thiazide, right? As I mentioned, because if you give diuretic or thiazide medication, patient will lose lot of water from the body, and also sodium will be lost, because patient will urinate a lot and water and sodium will come out. So that's why you should avoid diuretics. If patient complain of pain, instead of NSAIDs, you can give Tylenol, which is acetaminophen, which is okay to give, right? So Tylenol okay to give. A nurse was giving health teaching to a client newly prescribed lithium medication, right? Which of the following client statement indicates understanding about the medication? So I can still eat my favorite salty food. That is the best option here. You cannot when my mood fluctuates, you cannot increase the dose as option 1. You cannot crush the extended release medication, because otherwise it will absorb in your body immediately instead of period of time. Drinking too much cranberry, nothing to do with. So option B is your final answer. I can still eat my favorite salty food. Sodium should not be dropped from the body, so sodium food is okay. The patient has been prescribed lithium for treatment of bipolar disorder. Which instruction does the nurse include in teaching? Right away, your answer should be, it is important to maintain a balanced dietary salt intake. Next question, a 35-year-old client with bipolar disorder is being discharged on lithium carbonate. The nurse provides teaching about lithium therapy. Which client statement indicate a need for further teaching? Further teaching means, those who are new nurses, further means what is wrong here. Select all that apply. So I will try to drink 2 to 3 liter per day. That is okay, right? You have to drink 1 to 2 3 liter. If I get a stomach bug and with vomiting and diarrhea, I will keep taking. No, if you have vomiting or diarrhea, you have to hold the dose and tell the doctor. So that is option B is wrong so far. Let's go to number C. I know I need to have my blood level checked regularly to make sure that lithium is safe. That is right. You have to check time to time. I will use ibuprofen regularly for my headache because it's over the counter. That is false. You have to avoid NSAID, right? Ibuprofen, naproxen, all you have to avoid. Option E, I should not make big changes in my salt intake with taking to my provider without. So yeah, that is correct. So what are the wrong option here? Option B is wrong and option D is wrong here. So other than that, all are right answer. So that's a wrap of our practice question and answer, and I hope you got most of your answer right. So if you have not watched the content video on this topic lithium, please make sure you watch it, and once you watch it, it will be easy for you to solve all of your question and answer. Good luck.